two of the most common things I'm going to see as a urologist, because they're just progressive problems that happen to some degree in every man, are enlarged prostate trouble, or BPH, and problems with your erections. And they're a very similar discussion. They are both things that are normal. They are both things that are kind of going to happen to every guy. So, you get out on a golf course with older men, and undoubtedly, and they're not going to talk to you about how bad their erections are, but they will talk to you about how bad their peeing is. So, and also how much you want to do for it, how motivated you are to solve the problem, has everything to do with you, and it has to do with the patient saying, I'm ready to address this, and now let's do it. And the same speech for both of them, really. You're going to start with pills, and if pills are no longer cutting it, you're going to have to move to something that's more involved. With enlarged prostate, we move to procedures, some easy, some harder, and erections, we move to things like injections or procedures. So it's a very similar discussion, but there is overlap. There used to be a lot of research into, does BPH cause erectile dysfunction? And because you would always see them go hand in hand in aging studies. And the simple answer is no, one doesn't really cause the other. The problem though is BPH can be annoying. BPH can be, I always feel like I have to pee. BPH means sometimes my bladder's not happy about having to try to squeeze my urine out through the prostate, and it's going to be jumpy and irritated. And what that can sometimes mean is when you're trying to have an erection and when you're trying to have intercourse or make love, you have to feel like you have to pee. You might leak urine. You may have to stop in between and then try to pee. And now you have an erection and you're sitting there trying to pee. You can picture this, guys. This is not cool. This isn't conducive. And so a lot of times people just give up on intercourse because they're already in that place where maybe their partner's not interested anymore. They're going to have to feel like they have to pee. And it just kind of goes into this whole thing of, I'm getting older. It's not like what it used to be. And people give up. So that's one of the reasons I say, look, these are problems that are eminently solvable. They're different problems, but they're problems that we can treat. But anyway, those are the take-home messages. BPH doesn't cause erectile dysfunction, but it tends to go hand in hand.